Unity Health Harris Medical Center in Newport, McLean Street. Want to introduce to you Dr. Ian Parker to the program, and welcome, my friend.
Thank you, thank you.
I had a great visit with Dr. Parker, prior to us getting on the air, and I want to get to some of the information that we talked about. But first of all, a guy from Vermont, up in the northeastern part of the United States, joins us in Newport, Arkansas. I'm glad you're here, sir. Welcome to Arkansas.
Thank you.
Let's talk a little bit about you, and want to talk a little bit about your training, where you grew up, and schooling, college, and educational training. Tell us a little bit about Dr. Parker.
Okay, well, I was actually born in Maryland, and I've come from a military family, although my father wasn't active or reservist at the time, but we moved around a lot. When I was 8, we left Maryland and moved up towards the north in New England and Maine and Vermont area in New York State. But we lived in a lot of places. I lived in a lot of places, mostly Vermont, Canada,
right.
Maine, etc. But done a lot of traveling, got to mostly with my mom and things like that. So.
Tell me about college. Tell me about college and medical school. Where'd you get all your training?
Well, I started off my college in Maine,
okay,
at Bates College, and then later on my father suggested it would be cheaper actually go to a state school where he was living in New York State. Cornell University actually had the agricultural program in Ithaca, New York, and actually, funny thing is, because I also do pig farming, and some of the original texts in pig feeding sciences were written actually at my alma mater, which I later on found. I just recently found out.
Is that
right? From the Cornell Agriculture and Life Sciences program, way back in I think it was in the 60s.
Okay.
When they wrote some of the textbooks on, premier textbooks on livestock feeding. And so I finished my studies there in sort of bioorganic chemistry and genetics, and then started my life after.
And then here we are today.
Yeah.
I'll get into your.
It's been a long road, but I think it was worth it.
You bet. Yeah.
Why
a doctor? Where along the way did you decide that I want to be a doctor?
Well, my mom actually, I think, always wanted me to be a doctor. But I was more interested in the research sciences when I was younger. And, but through the research sciences, doing a lot of, later on doing a lot of work with cancer models and genetic manipulation of mice and other organisms, et cetera, for cancer studies, and working in a human genetics department, which sort of brought cancer closer to sort of a patient involvement level, and understanding more of the human aspect of all this research and where was it going and what was it doing on a personal level. For instance, even my mom later would develop a leukemia, and things like that sort of changed my perspective as I was getting older in life as to what was the relevance of all this study and all this knowledge of the medicine and the molecular aspect of these diseases, studying the pathophysiology, where was it all going and how was it being used actually to help someone.
Right.
A person.
You bet.
Or many people on a personal level. So as she became sick and my studies started turning more and more to my options to how can I help her and how can I help other people with this knowledge base. And I became more interested in how you could apply these, for instance, all this genetics and cancer study to actually helping someone live longer, even if it's another year, would spend with their family and to be here on Earth. I thought it was much more worth it than just staying in the laboratory all the time. And also, as I got older, I became more of a people person,
right,
and less introverted. and more interested in my community and things like that, which pushed me more towards medicine.
Interesting.
And how I could help people with that, with those scientific applications to actually have a healthier, happier existence while you're here on the planet.
Let's talk a little bit, Doc, about the title on the door says DO.
Mm-hmm.
Tell us what DO means and tell us kind of some expertise of what you're trained in and
Well,
what we're trying to do here at Unity Health and Harris Medical Center.
Okay, well, DO is basically any doctor. The difference between who studied in osteopathic philosophy or osteopathic medical school, although medical doctor we consider allopathic medicine and DO osteopathic medicine, they actually marketed this distinction of, or copywrote that MD for the allopathics, because they've always had been at least 80% of the market. DOs traditionally have been at least 10 to 20% of the practicing physicians in the United States. DOs were founded by Andrew Taylor Still, who was actually a Missourian, son of a preacher, a very spiritual and religious person, who was an MD himself, and in the late 1800s, after suffering the effects of scarlet fever in his family, 3 of 5 of his children died, unfortunately, and he was sort of disappointed in the limitations of allopathic medicine at the time, so he felt that he could start a movement in medicine which was more preventative based and more holistic based, in other words, integrated approach, which they teach now in allopathic schools included, that would be better off for the patient. And so he was a brilliant man. He came in, he was living at around the same time as all these other geniuses, for instance, you know, a little bit before Tesla, but also a lot of other people at this time in the late 1800s. And he invented these techniques called osteopathic manipulative therapy, or OMT, or osteopathic manipulation, which basically became the foundation of all manipulations in the world, including those practiced by physical therapists, chiropractors, massage therapists, anyone who does manual techniques. They're usually found a basis in osteopathic manipulation, which was founded by Andrew Taylor Still, the first DO.
Right, okay.
And so what he wanted to do was use these hands-on techniques to help people stay healthier by freeing the restrictions they have in the body, because his theory about energies and also blood flow, lymphatic system, nervous system, these are all tissues, and when there are restrictions in tissues, you get stasis, and with stasis comes disease, or vice versa. And so in a lot of these situations, for instance, the first studies were done in the 1920s in the hospital during the flu epidemic, and they noticed that people who were receiving manipulations, the OMT in the hospital, got out faster from pneumonia at the time, because again, you're dealing with freeing restrictions, lymphatic flow, getting rid of many of the lactic acids, etc., that builds up the toxins in the system, getting better lymphatic flow, getting better respiration, and by using, for instance, manual techniques to treat rib dysfunctions and diaphragm dysfunctions, etc., all help the person to be healthier, and to heal better, and to get out of the hospital faster.
Yeah, there you go.
So his OMT techniques that he teaches all medical students any DO learns these techniques or introduced to these techniques when they go to medical school. So we learn all of the other academic information, but in addition, we get extra training in the OMT techniques. So we can use these as an option. Unfortunately, most DOs do not specialize in the OMT techniques or even use them when they graduate. They pursue fields such as cardiology, obstetrics, plastic surgery, you know, or neurosurgery, radiology. So they don't really get a chance to use them, but there are a good number of primary care physicians who still use the techniques, and also people such as myself who are OMT specialists, or in the modern term is neuromusculoskeletal medicine, where there's a more of a neurological based emphasis on training with the musculoskeletal diseases and things that are going on, where we get extra training in residency after medical school,
Okay.
just in the techniques.
Right.
And for
Right.
instance, my program was an integrated program, one of 7 in the country, in family medicine and neuromusculoskeletal medicine. It was a 4-year residency program after medical school. Most family practitioners only go for 3 years in residency, but my training was 4 to 5.
Right.
Because it
Absolutely.
included the integration of the neuromusculoskeletal training. And with this, we got extensive training in hospitals, we were often consulted by surgical teams to treat their patients post-surgery, because they realized that the techniques used at freeing the body of restriction would help things like constipation, for instance, after bowel surgery.
Things that you wouldn't
with-
normally
with-
think.
With,
Yeah.
with back pain, with tissue restriction, even for post-hip replacement or post-knee replacement. And these treatments can help, for instance, with getting the patient out of the hospital faster and recovering quicker. But we also did a lot of training in the OB-GYN ward, because as you know, moms often suffer from a lot of low back pain, especially even after pregnancy. And so we worked a lot with the postpartum mothers, treating them with OMT techniques for back pain, although we also work with pregnant women who are also suffering from back pain. I have several patients myself who are expecting and come to me for treatments for back pain or migraines, etc. As well as cancer patients, a lot of elderly or other patients with, for instance, pneumonia or what we call lymphatic issues, for instance, chronic hereditary lymphedema, or for instance, even the edema resulting from CHF, et cetera, or surgeries, or et cetera, that we often rounded on in the hospital.
So you do all this part, the special parts of your training, and you have them in place here at Unity Health, in addition to just doing some family practice medicine?
Yes, for the most part, I do family practice. We're here 5 days a week now. Occasionally, I do a lecture in Searcy at the Family Medicine Residency Training Program for didactics. But we're now here in Searcy 5 days a week. We're open on Fridays also. We're one of a few physicians that'll be open on a Friday. So feel free to stop by and say hi. We take walk-ins. You don't have to necessarily have an appointment, but just walk on in. If you're curious, or in the neighborhood, you can stop by. Or if something happens, God forbid, if you sprain an ankle or something like that, we'll also have x-ray facility here available on Fridays also, and across the hospital. Harris Hospital is right across the street if we have to do CAT scans or something like that. And the lab is going to be open also on the Friday, available.
Well, there's no doubt that you're a welcome addition to the physician staff here in Newport, and a very interesting man, to say the least, because we had a 30-minute conversation prior to getting on here, and just a people's person, a people's doctor, a guy who's interested not only in just not your health, but he's interested in you. I can tell that,
Yeah.
and I can tell you enjoy what you do.
Yeah, I love
Great
it.
fulfillment.
I love it. I think it was worth all the time it took and all the hardship it took to get to where I am now. And I'm very grateful to Arkansas for welcoming me, because I think Arkansas actually was a very progressive state to be interested in, and also the specialties such as neuromusculoskeletal medicine, which gives people, it's kind of like it gives people an alternative to modality for treating pain. Our approach, first of all, is holistic or integrated. We look at all aspects of that person's life, including even relationship stress, job stress, bills, emotional issues, depression. They all have a relationship on pain pain levels, pain perception, etc. So we tend to look at the whole person in terms of what its contribution to their pain could be before using our primary modality is the hands-on techniques, the manipulations, excuse me. But we also do standard medical treatment. I often refer out to orthopedics or neurology if there is an issue that's beyond. But I also likewise get referrals often from neurology and from orthopedics for issues that may be non-surgical and they can't figure it out, or migraines that are intractable, or the person has tried all the other migraine prophylaxis like topiramate or et cetera, and they're still having issues, or the Botox didn't work. And so occasionally I'll have referrals from neurology and with the neuromusculoskeletal medicine. So it's, but in any event, the approach is to look at the whole person and to find out more of the cause of the pain rather than to just treat the pain.
So what you're telling me is when life gets in your way, come see this man right here. When life gets in the way, when you've got that pain, you've got those things that you don't know what's wrong, and when you talk about the muscles and the skeletal system, along with the nerves in the body and how things operate, and the body's such a vast array of stuff that the common folk don't know. We don't know a lot about that.
People are complicated. Everyone's more complicated than they even imagine, which is also, people talk about spirituality and religion and God, and it makes you more accepting of the fact that there must be some sort of higher power involved in all of this, because there's no way that all of this could just coincidentally be so fabulously complicated and work so well. Exactly right. And it's so myself, I think God is a very important part of my life, and spirituality is a very important part of my life. And I think I have been blessed in that regard, and I'm even with being here. And you have to think about things like that. But we get an amazing amount of very interesting cases here because of the neuromusculoskeletal medicine. For instance, such as Arnold-Chiari malformation, myotonic dystrophy, not muscular dystrophy, but myotonic, which is even more rare, dystrophy, but also treat a lot of TMJ, trigeminal neuralgia, along with the migraines. And migraines themselves can be very complicated, or very complex, and I can talk to you anytime you want more about that. Serotonin syndrome, all sorts of very interesting things. And Arkansas is amazing in how it can throw things you've never seen in, or at least I've never seen, the rare zebras that we talk about in medicine at you. Walk right into this door in a town like Newport. Yes, sir. Okay, yes, and things, for instance, that there may be only 200 in the country.
Well, we knew we were unique in Newport, Arkansas. There's no doubt about that.
They'll walk right into that door.
That's exactly right. Yeah. It's a pleasure to meet you, my friend. We're excited about you being here, and wrote the phone number down. Of course, it's at the bottom of the screen right there, 870-495-1349 if you need more information. If you need an appointment with a man that can figure out your pain right here, this man right here is the guy. Once again, my friend, good to see you, Dr. Parker.
Thank you so much.
And we'll visit some more interesting stuff, what you bring to the table, and no doubt that Unity Health and Newport, Arkansas is a big plus to have you here. Thank you, my friend.
Thank you so much. Thank you.